Andrej, welcome to #Mental Health Day.
Thanks for having me.
So the first thing I want to ask you, Andrej, is could you tell me a little bit about yourself and your journey to where you are today?
Well, it's not been a plan that I'm following, to be honest. So there's been a lot of accidental things that happened to me, which led me towards mental health. In the end, I studied law. I haven't studied psychology or psychiatry. So basically, I was in the business, but then I finally understood that I need a purpose in my life. I need to actually do something meaningful, and just earning money is not the thing that actually works for me, and not something that I want to do. So I went to the NGO business with some management roles, and what I loved at that time, I was helping a long time ago an NGO which actually connected adult volunteers with kids from children's houses and how that works. And the world of mental health provided me a completely different perspective on what needs to be done specifically. So that's where I fell in love with mental health. And of course, I've had my own bit of lived experience and went to psychotherapies a couple of times in my life. So the world of mental health has always fascinated me. So I became the head of the League for Mental Health in Slovakia, a little country neighboring Ukraine, which I'm from originally, and the League for Mental Health in Slovakia is a member of Mental Health Europe, where I became the president as a chair of the board, basically. So that's a very brief journey, but the interesting part is that it has been always silver lining the idea that actually what needs to be done in mental health is the engagement of us all. If it's not a matter of us all, regardless basically of the profession, then it just won't work. The change will not happen.
You talked about Ukraine then, and of course we see daily the images in relation to Gaza, these tragic, unfair, horrendous images that we're seeing. Of course, we know what's happening in Sudan. We know what's happening to the climate. There's discussions around nuclear weapons. What impact is all of this having on our mental health?
It's tremendous. When the full-scale aggression in Ukraine started in 2022, there were a lot of people fleeing Ukraine and coming over to Slovakia. And we've heard not only images, but we experienced the stories. So some of those people are still my colleagues in Slovakia. We've opened a branch in Ukraine, so we are providing a training program there for volunteers to be able to actually do something about the situation, because there's such a huge lack of manpower there. Of course, much greater than in England or in Brussels or in Slovakia. So it's really been the stories. So it's hard to actually understand it, but there's more than 1.5 million veterans in Ukraine already. Because if we start with the 2014, and the soldiers are rotating all the time, then the number of communities that are being affected is just tremendous. So when the people came from, the refugees came from Ukraine to Slovakia, what they were saying, and especially the psychologists, is that they are bringing the war to Europe in their heads. And of course, in their minds. And I think that's exactly what is happening. And I think we are really facing a very hard time being able to actually identify the humanity, the humane thing in everything that's going around. And listening to the stories, people sometimes forget what it was like in Mariupol. What it is like every evening when the cities are under shelling. So I think that in the end we have to. I think that we are really facing some tough times, and the impact on mental health is really, really, really big.
Yeah, mental health pandemic. I mean, it's because if you're in Ukraine, or if you're in Gaza, or you're in Sudan, or you're in Yemen, or you're in Syria, or wherever you are, Myanmar, I mean, And also just here at the moment, here I am in the UK. We've got problems on our streets. The communities are changing rapidly. It's really tough. And I guess that, this phrase of like, can we create global peace without inner peace? The answer is, I don't think we can have global peace if all of those people, those refugees that we're talking about, are carrying the wars in their minds. How do we find peace when so many people are suffering in such a way? What's your assessment of the long-term situation when things are as they are?
Well, that's of course hard to predict. I think that the consequences will be very, very, very severe, as are the consequences of COVID and the social isolation, especially for younger generation, and this will have some very, very, very hard consequences. But that's basically what also this World Mental Health Day is about. It's about services being provided in emergencies and catastrophes, right? And there's a good thing in this, even though the situation might seem very almost challenging and kind of tragic sometimes, and there's a logic to it, of course. But the good thing is that the United Nations and the major international organizations have developed actually a framework of what to do in emergencies, and the world is becoming a series of emergencies, to be honest. Who knows what the future brings? So it does make sense to really take a look at what they've prepared, and they've developed this mental health psychosocial support framework, which actually says one very, very important thing, and that actually answers your question: what can we do about it? And that is that at the center of everything that is being done in an emergency, you need to absolutely focus on the mental health and well-being of those affected by the emergency. And in order to be able to do that, people need to live somewhere. People need to eat. People need a place, a shelter. People need healthcare and a lot of other things. But that is all should be provided with the ultimate goal of having a level of mental health and well-being, which is an inspiration for us in Europe as well.
Okay, so tell me a little bit about your organization and what it does.
Mental Health Europe is the largest independent network of mental health providers and organizations representing people with lived experience in Europe, which is advocating for the psychosocial model of mental health, for the recovery-oriented services and activities, and a human rights-based approach. So we are basically providing advocacy at the EU level mostly, but at the European level, and trying to influence the public policies on what needs to be done in mental health so that these principles are being adhered to.
For anybody watching this program today who might be in a dark place, finding it difficult to understand everything that's going on around them, what's your recommendation? What can they do?
Nothing in mental health can be changed unless it is the matter of all of us. So if we want better mental health for all, it will never happen in a way that some professional will arrange a service that will provide for all the needs of everybody who needs some kinds of support. That just doesn't work that way, because there will never be enough professionals. The manpower will never be sufficient. There will never be enough psychiatrists, psychologists, and a lot of other professions. It is up to us. It is our responsibility to actually take care of our own mental health and to be able to provide very simple interventions to other members of community, of family, of colleagues in the work environment. Because without that, there is no country who is rich enough to pay for all the services. So we need to be engaged. And when we are engaged, every one of us can do very simple psychological intervention, which is listening. Everyone can listen. And by listening, we are providing a safe environment for those who will listen to. And we can do that in small groups, one-on-one, or in large groups. We can do that in our work environment, in schools, basically everywhere. But we need to, there is a lot we can do, actually.
If there was one thing that you wanted everyone to know about the issue of mental health, What would it be?
It is a journey. It is a journey. And a long time ago, mental health was about the idea that if there's something wrong with your head, you will get to a hospital or somewhere, to a refuge, where some professional will take out the bad thing, throw it away like a piece of meat, and then another professional will take care of you and get you back into society so you can continue your normal life. Well, that's not true. That has proven to be very bad and very wrong, because that has actually caused a lot of stigma. So I think the important thing to understand is that it just doesn't work that way. The modern concept of mental health is about being able to live with what you have. So, and everybody with some kind of support, most of it in communities, are able to actually live a fulfilling life with whatever diagnosis they have. I'm not saying that we don't need professionals. Of course we do need them. And there's a lot of them also in our organization. But the majority of what needs to be done is to actually enable communities to be engaged and to be able to provide very simple support for their members.
Andrej, it's amazing talking to you. If people want to find out more about your work, how can they do that?
Well, the easiest way is, luckily we have internet, which has not always proven to be the best solution for everything, right? And the social networks has, I think, proven, given the world a lot of challenges. But we have mentalhealtheurope.org, where you can find all the information, a lot of resources also about digitalization, also about AI and mental health, about coercion and the whole UNCRPD world, and a lot of other resources, of course.
Andrej, the best of luck with your work. Take care, and thanks for participating today.
Thanks for having me, and have great mental health.